Hi, I'm Tammy Burns. I'm a registered nurse here at Barton Healthcare Systems for the last 26 years. I have been involved in past ethic committees at Barton and been involved in disaster management, the crisis intervention team, and emergency medicine since I've worked here. Since the end of March, I've been part of the Barton COVID Bioethics Committee. The last 2+ months and this pandemic have been a shock to all of us at Barton Healthcare and to our community. And we are grateful to all of the Barton team for the great efforts expended to ensure our community is in good hands. One piece of that has been the work of our COVID Bioethics Committee. Our team, including physician providers and nursing staff from Barton, has explored the unique bioethics challenges associated with the COVID-19 pandemic. This situation forced us to examine our readiness, our planning, our protocols, and our resources. Through that examination, we know now that we are prepared and coordinated throughout our health system. Part of that preparation include the creation of a manual, the document attached to this video to guide us through this difficult decisions that may be necessary in this particular pandemic or others. The attachment represents the way that we, throughout our hospital system, will work together to navigate the challenging decisions that we may face with limited resources. Drawing on numerous resources from around the country, the healthcare world, and our community, this document provides the framework for continuing to provide care and managing our resources in a responsible, fair, and equitable fashion during a pandemic. New ethical challenges are before us in this moment. They are the driving reason for our committee and this manual. The core ethical guidelines of duty to care, to steward resources, to plan, to provide distributive justice, and to be transparent guide this tool. The ultimate goal is to do the greatest good for the greatest number, and should this framework come into effect, it is about focusing on community health and preservation. This manual adheres to and respects the non-discriminatory practices of Barton Health as well as the state medical boards of California and Nevada. The purpose of this manual is to support our healthcare team during the COVID-19 pandemic by providing you a framework for decision-making that is ethically consistent and transparent in process. Our team was created and is here to support the process and to be your partners in making challenging decisions when allocation of resources is limited. On behalf of Incident Command and Barton Health, the COVID Bioethics team asks that you review the attached manual. Read and become familiar with its contents, the framework, and the workflows to help us all be prepared in case implementation is necessary. This work was undertaken with all of you, our colleagues, our community members in mind, because we must work together. Thank you for participating in this learning. Please ask questions now so that when we need this manual, we'll be ready together.